Tasha, we need to talk.
Listen, I just want you to know, the couch in the swimming pool was not my idea. I left Andy Rourke and Vicky Byard in charge of that, and when I came back, it was at the bottom of the pool.
No. I mean, we need to talk. You spent so much time in the last few days talking to technicians about how to grow in their jobs. Now it's your turn. Let's talk about what you've done.
Okay, sure. I've done a lot of stuff. Where do you want me to start?
Let's start with your passion for anesthesia and pain management.
Okay. I'm fortunate to work for a really awesome practice where they really utilize technicians. And the head doctor came to me one day and he basically said, what are you passionate about, what you really like?
Right.
And I said, I love anesthesia and I really like making the patients feel better, and I love making them feel better after surgery and pain management and making sure they go home feeling better. So I want to do that. And that's basically what I did from there.
And you were lucky because you had a mentor, a veterinary mentor, who really stepped in and asked you what you wanted to do. For technicians who don't have that, what is your first advice?
Well, my first advice is you got to be your own mentor.
Right.
Like, you really have to go after it. And there's so many things nowadays online. There's all those on the floor at Dove videos. There's Facebook resources, plug for the anesthesia nerds. There's Facebook resources that you could go to. There's all kinds of forums that you could go to get more education yourself. Even if you can't afford to go to a conference, there's so many things online that you can do to educate yourself, to make yourself that point person at your practice.
One of the things you and I talked about quite a bit was the level of trust that has to happen between a veterinarian and a veterinary technician on both sides for them to both work together well. So can you describe what is it, when you first come into that practice, what do you need to do, both from the veterinarian's perspective and the technician's perspective, to build that trust so that you get to be utilized effectively?
Well, trust doesn't happen overnight. It's certainly, it's a process, but the veterinarian has to be willing to help grow their technicians, and subsequently the technician has to want it. The technician has to go to the veterinarian and say, I want to do this. This is what I'm passionate about. Help me get those skills and get to a level where you will trust me with this anesthesia or placing the catheter or intubating a patient. You know, the veterinarian should work together with the technician, so they both are working towards the best goal for that patient. The veterinarian doesn't need to be calculating up the drugs all the time or deciding the drugs. That's something that they should do together as a team to create the best outcome for that patient.
You mentioned the Veterinary Nerds group. Tell us about how that started and what you're doing with it.
So the Veterinary Anesthesia Nerds is a Facebook forum that I started for people who are in the veterinary field who really like anesthesia.
And why?
Because actually it was a selfish reason. At home one night I saw that there were other veterinary groups, and I knew that I wanted more anesthesia information. And so I thought, why isn't there an anesthesia group? I wish there was. And then I said, you know what, I'm going to start one.
But when you started this, you didn't have this idea that it was going to become something that it has. You had an idea just of communicating with other team members about a topic.
Yes, I just really thought I could have a couple of friends, like maybe 30 or 40 people, and talk to them about anesthesia and get their ideas and tips and tricks. I always like to hear what other people are doing and how I could do it better. And now it's grown to close to 4,000 members. So we have a lot of people on there talking about anesthesia and talking about ways that they can elevate their practice, make the experience better for the patient.
So if you were to give everybody one tip about what they need to do today if they are ready to grow their job now, what would you say?
Educate yourself. Be your own advocate for your career. Don't wait for somebody else to come and give you that opportunity. Go out and look for it yourself, and then work together with your veterinarian to make it happen.
And when we talked earlier, we talked a little bit about how some team members may feel, I don't have that opportunity because of where I live or the size of practice. What do you say to them?
I mean, again, I grew up in Miami and then I moved to rural Michigan, so I understand veterinary clinics where you're maybe only a one doctor practice and you just don't have that. And you're not going to have the opportunity to maybe specialize. But if your passion is dentistry, then go get educated in dentistry and be the point person. You may not earn your VTS, but you can still be that trusted team member who knows everything about dentistry or pain management or internal medicine. Whatever your focus may be, just get as much education as you possibly can so that you're the go-to person in your clinic.
Great.